So you have one hip that's higher than the other one, and your pelvis just looks crooked. There is that lateral shift. There is just crookedness of your pelvis, and you're wondering, how do you fix that? What does that look like? What does the problem fixing looks like? What are some of the symptoms that you may be having as a result of this? Are you going to be able to stretch this and for the problem to go away, or is there more to it? That's the subject of this video. So let's understand what hip hike means. That means this is your pelvis. One side is higher than the other one. Unless you have scoliosis. Unless you have anatomically one leg shorter than the other, anatomically, not functionally. No, it is not okay. And no amount of stretching is going to fix it. Why is that? Because when you stretch something, you did not find out why it was tight, did you? You gotta understand, things don't just get tight randomly because they felt like it. They're reacting to something else. So this is all compensation. These are all manifestations of all the modifications your body is trying to make to try to stabilize your pelvis. I know it doesn't make sense when the modification is that, but who knows what's happening on the inside? Who knows what else is going on without examining you? And not every examination is the same way. Unfortunately, when it comes to these types of things, we're looking at range of motion. Listen, I totally shattered my pelvis, my hip socket, I should say, and I broke my pelvis in 2 places, and I broke my lumbar in 1 place. And I never lost range of motion. So that doesn't mean I was functionally good. So our cueing and our gauge of what okay is, in my opinion, is off. So when you have a hip hike without the presence of scoliosis or anatomical short leg, this modification needs to be identified. Obviously it is identified, but the source of this modification needs to be identified. So how do we go about doing it? Functional mobility, functional assessment. How you walk. When you walk, are you doing the right movements? That means the person who's assessing you needs to know exactly what right looks like. Needs to look for this subtle cues. And maybe the not subtle cues everyone sees. It's the subtle cues, the connection of the dots that matters. This channel is all about that. If you have not subscribed to the channel, please make sure you do. If you have any questions or comments, make sure you use the opportunity. Put them down here. If you have any suggestions for any videos, please do it there as well. I do review these things. So back to this situation, how would I fix it? I want to identify what else is going on. And a lot of times patients don't tell us everything, but a good clinician is going to know what questions to ask. You are the holder of the problem. You are the holder of the solution. The right clinician will ask the right questions to be able to connect the dots and see the path ahead, because we cannot solve a problem if we don't see that path. When it comes to functional mobility and pelvic stability, we know what the right environment is. So how far away from that right environment you are is going to give me an understanding of what this path is going to look like. When I ask certain questions, when I tell you to do certain movements, and it takes you 10 attempts before you do the right performance of the movement versus 2, is going to tell me what your cortical connection is. How many times does this poor brain, have to do something before the actual movement happens, the actual right movement happens? That is going to identify how long it's going to take before this person can even understand what right looks like. It doesn't matter how long it is, but it's good to have the right expectation of How long does it take to fix this problem? But do understand, fixing of the problem is something that you need to learn. So you can't be just a patient. You need to be an apprentice. You need to be there to understand and gain the knowledge. I always start with biological breathing. We're going to make sure we put biological breathing at the end of this video. But if you had subscribed to the channel, you know already what that means. Biological breathing is what we learn by studying human babies and how they breathe. It's not to sustain your life. There's a lot more to it. Watch the video. You'll see what I'm talking about. I always start with biological breathing, and I always follow the progression of movement that we all did from the time we were a baby until we became running toddlers. Every single walking human being on the planet Earth has gone through that step. It's so precise that we make tables and we compare child developmental movements to that chart to decide if they're on target or slow or fast or whatever the case may be. So that is the manual of movement. Why do I need to go reinvent the wheel? I just read the manual. I just do the manual, and I just compare where my patient is to that manual. And in the process of doing that, they understand, the patient understand what right looks like. During that process, they understand what their tendencies are. So by the time they leave my office, they have the knowledge. They don't need to see me. I don't need to see them. Hallelujah. That's how it should be. I love what I do. I honestly do. I hope this video came across the right way. I hope you understand that this is not some kind of a complex problem. It's only as complex as you make it. The sooner you address the problem, the better off you are. You already knew that. I love you guys. Thanks for watching. Until next time, take care.